Good morning. This is Follow the Science, a Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Meharry Medical College, and also principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee SEAL, and site PI for HealthWorks, HRSA-funded COVID prevention program established through a subaward with the Morehouse School of Medicine. Today is Monday, October 10th, 2022. While the trend in new cases, hospitalizations, and deaths across the United States attributed to COVID-19 continues to trend downward, there are new studies that suggest that we need to remain vigilant. As the U.S. heads into a third pandemic winter, the first hints are emerging that another possible surge of COVID-19 may be underway. The first signs of what may be in store for us is what's happening in the United Kingdom and Europe, where new infections have risen 8% in the past week. Rates of COVID cases in the UK increased by 70% over the past 2 weeks. Germany experienced a 107% increase, and with a similar surge occurring in France, which experienced a 65% increase in new COVID cases. Cases in New York also have begun to tick upward again. The rising trend in new cases of COVID-19 also is seen in the CDC's wastewater dashboard, where virus levels have risen over the past week in some regions of the country, including the Northeast and Midwest. The pattern for the past 2 years has been Europe, New York, the West Coast, followed by the rest of the nation. So we should be watching the West Coast to see if this pattern will continue. Today, I'm going to talk about the importance of everyone getting the new bivalent Omicron COVID booster. It's particularly important for persons over 65 years of age and for others who are immunocompromised or who have other chronic diseases such as diabetes, hypertension, or cardiovascular disease to get the new booster. I will then talk about other variants that are being watched and follow that up with a discussion of current trends in COVID. I will then provide an update of new cases, hospitalizations, and deaths, both nationally and in Tennessee. It's important that people understand that getting the new bivalent Omicron booster, either the one produced by Pfizer or Moderna, and that there is not a significant difference between the two. The booster ramps up to a high level of protection in about a week, faster than the first vaccine dose, and certainly within 2 weeks. Some studies have shown a benefit to changing vaccines, so there's nothing wrong with starting with a Pfizer or Moderna primary series or booster and then switching to a Moderna bivalent booster or vice versa. While we're not sure how long the new booster will be protective, if it acts like the previous boosters, it will provide optimal protection for 2 to 4 months, good protection for 4 to 6 months, and less protection, but still some after 6 months. The booster is called a bivalent vaccine because it was formulated to address both the original COVID virus as well as the Omicron variant. Prior immunization, either from having been immunized, including the first booster, or having had COVID prior to Omicron, is not very effective at protecting you from getting Omicron. SARS-CoV-2 vaccines based on the ancestral strain or the original strain offers limited and rapidly waning protection against Omicron COVID-19 disease. The bivalent vaccine has shown to boost Omicron BA1 specific neutralizing antibody titers 14.6 fold compared to baseline and 1.82 fold higher than the initial booster. A separate study published on October 6, 2022 in the New England Journal of Medicine found that the new bivalent Omicron booster produced by Moderna and administered as a second booster is over 93% effective against getting COVID-19 after the initial primary series at a median of 5.3 months after the two-dose 100 UG primary series immunization without any evident safety concerns. Eligibility for the bivalent Omicron booster includes 1. Completion of the primary series, i.e., the first two doses. 2. The Pfizer bivalent booster was authorized for persons 12 years of age and older, while the Moderna vaccine booster is authorized for people 18 and above. 3. Whenever your most recent COVID-19 shot was, you must wait at least 2 months before getting a bivalent Omicron booster. 4. You are eligible for the bivalent booster whether or not you received the initial booster. 5. With the FDA authorization of these bivalent boosters, they also removed authorizations for monovalent boosters or for both Pfizer ages 12 and older and for Moderna for people ages 18 and older. And 6, both Pfizer and Moderna have submitted requests for emergency use authorization to the FDA for children under 12 years of age. But currently, children ages 11 and younger cannot get a bivalent Omicron shot. They can still receive, however, the regular monovalent booster shot 5 months after their second dose of their primary series. For children 4 and younger, the FDA has not yet authorized any booster shot. Although the Omicron BA.5 subvariant continues to dominate globally, other variants are beginning to spread as well. We shouldn't be surprised if another new, more transmissible variant emerges this winter, according to Dr. Anthony Fauci. Emerging research suggests that some new subvariants, including one called BA.4.6, appear to evade immunity even more effectively than BA.5. Although it's unclear whether any of them will overtake BA.5 as the country's dominant COVID strain. Another highly transmissible mutant Omicron strain of COVID-19 is called BA.2.75.2. It's rapidly becoming dominant in India and has shown up in several other countries around the globe, including the United States. The WHO and the CDC regularly assess new evidence on variants detected through epidemic intelligence, rules-based genomic variant screening, and other scientific sources, and describe the variant as either a variant of interest, of concern, or under monitoring. For these variants, evidence is reviewed indicating the level of transmissibility, the severity and/or immunity that is likely to have an impact on the epidemiological situation. For variants of interest, evidence is available on genomic properties, epidemiological evidence, or in vitro evidence that could imply a significant impact on transmissibility, severity, and/or immunity, realistically having an impact on the epidemiological situation. However, the evidence is still preliminary or is associated with major uncertainty. For variants of concern, Clear evidence must be available indicating a significant impact on transmissibility, severity, and/or immunity that is likely to have an impact on the epidemiological situation. And for variants under monitoring, SARS-CoV-2 virus must have been detected as signals epidemic uh, through epidemic intelligence, rules-based genomic variant screening, or preliminary scientific evidence. Variants listed as under monitoring must be present at least one outbreak detected in a community, or there must be evidence that there is community transmission of the variant elsewhere in the world. Both of these new subvariants have been identified as variants of interest and are being watched closely. Now is the time you should have your bivalent booster, and the CDC is strongly recommending you should take the bivalent booster as soon as you can. The variants targeted by the updated bivalent booster, are Omicron BA4 and 5, are expected to continue to circulate through the U.S. over the winter. With the holidays approaching, it's a good idea to get boosted. Excuse me. At least a week prior to plans for attending any indoor holiday event. This will both protect you from getting COVID or spreading it to your colleagues or loved ones, particularly older relatives. Current data show that about 90% of persons dying from COVID are over the age of 65. It's particularly important that older adults take the bivalent vaccine as soon as possible. While we don't yet know how long the effectiveness of the bivalent Omicron booster will last, it is likely that it will get us through the winter without any major new variants becoming dominant. While you get your bivalent Omicron booster, you may also want to get your flu shot at the same time, as this flu season is expected to be more severe than what we've experienced in recent years. The milder flu outbreaks of past years were likely due to the use of face masks, social distancing, and increased attention to hand washing and hygiene. These behaviors have largely been left behind as people are eager to move beyond COVID. Now, finally, I'm going to turn to the current COVID trend. Nationally, fewer than 70,000 coronavirus cases are currently seen each day in the United States, the lowest level since early May. Hospitalizations over the past 2 weeks were below 30,000 for the first time since June. Deaths were down 11% over the past 2 weeks and are experiencing their first sustained decline in several months. Deaths, however, remain troublingly high at just under 400 per month. The test positivity rate, meanwhile, over the past 2 weeks was 8.4%. An average of 757 cases per day were reported in Tennessee over the past week. Cases have decreased by 27% from the average 2 weeks ago. Hospitalizations are down 28% statewide over the past 2 weeks to about 419 per day, or 6 per 100,000. In addition, the number of deaths has fallen by 8% in the past 2 weeks to just under 400. Test positivity rate is down from 18% to 11%, still above the national average of 8.4%. 7 counties still have test positivity rates over 20%, however. There are currently no counties in Tennessee in the CDC's red zone for community COVID level, and only 6 now remain in the yellow zone. Counties in the yellow zone include Haywood, Lincoln, Scott, Claiborne, Hancock, and Unicoi. Davidson County and Williamson counties are now in the green zone for the first time in about 4 months. Of the counties in the yellow zone, 1 is in West Tennessee, 1 in Central Tennessee, and 4 in the northeastern corner of the state. 89 Tennessee counties are now in the green zone. The percent of the population of Tennessee that has been completed the primary series has finally ticked upward to 55.7%. For now, this is Dr. Paul Juarez from the Tennessee SEAL in HealthWorks Meharry, wishing you a good day.